Finding a tick on your dog, I know it's a moment of pure panic for any of us who love our pets. So today, we're going to cut through all that noise and talk about the real risk of Lyme disease. I want to give you the clear, simple facts you need to know.
Oh yeah, it is a feeling every single pet owner knows. You're just out for a walk, or you're cuddling on the couch, and then you feel it. That tiny, awful little bump. Your heart just sinks, right?
And your mind just starts racing. How long has it been there? Did I get all of it out? And of course, the biggest question of all, could my dog actually get sick from this? It's a moment that is just filled with anxiety.
But that's why we're here. My goal is that in the next few minutes, you're going to understand how Lyme disease really works, what signs to watch for, and most importantly, how to feel confident about protecting your dog. So let's start with the basics.
Okay, first things first, let's talk about the timeline. Because when it comes to tick bites, the clock really does start ticking the second that pest attaches to your dog.
This number right here, 24 to 48 hours, is incredibly important. For a tick to pass on the bacteria that causes Lyme disease, it generally has to be attached and feeding for at least a full day, sometimes two. This is our window of opportunity. And that's why finding and removing those ticks as fast as you can is one of the most powerful things you can do.
So what is this infection we're also worried about? Let's break down exactly what Lyme disease is and, how it actually operates inside your dog's body.
Okay, so in the simplest terms, Lyme disease is a bacterial infection. The culprit is this spiral-shaped bacterium, and its delivery system, well, that's the bite from a very specific kind of tick, the black-legged tick, which you might also hear called a deer tick. So how does this little bacterium work? Well, once it gets inside the body, it is incredibly sneaky. It can actually change its outer surface, kind of like a spy changing its coat to avoid being recognized by your dog's immune system. And this lets it travel through the body and set up shop in places like the joints, which is why we see lameness, or in more serious cases, the kidneys.
And this is how it all happens. It's a 2-year life cycle. A tiny larva hatches and gets its first meal, often from an infected mouse. The next spring, it becomes a nymph. And get this, it's only about the size of a poppy seed. This is the stage that's most likely to infect your dog. Finally, it becomes an adult, feeds on a deer, reproduces, and the whole cycle starts all over again.
So what would you actually see at home if your dog was one of the unlucky few to get sick? It's really important to know that the signs can be subtle and they often don't show up for weeks or even months after the bite happened.
The absolute classic sign we look for is something we call a shifting leg lameness. So your dog might be limping on their front left leg one day, and then a few days later, it's their back right leg. It's often described like they're walking on eggshells. You might also see a fever, some swollen joints, or just that they're not their usual happy self. They're tired, they don't want to eat. You know your dog best.
Okay, now before you start to worry every single time your dog seems a little bit stiff, I want to share what I think is the single most important, and honestly, reassuring fact about Lyme disease in dogs.
Take a really good look at this. This right here is the best news about Lyme in dogs. A staggering 90 to 95% of dogs that get infected with the Lyme bacteria, they never show any signs of illness. None. Their immune systems just handle it. Now, this is totally different from people, where most of us get sick. For our dogs, getting sick is actually the exception, not the rule.
So let's say your dog is showing some of those signs we talked about, and you head to the vet. What's going to happen next? Understanding the process can make it a whole lot less stressful.
This is a really big point of confusion, so let's clear it up. A positive test, like the one we can do right there in the clinic, just means your dog has been exposed to the bacteria and made antibodies. It does not automatically mean they have an active disease that's making them sick right now. Your vet makes that final call by connecting the test result with your dog's actual symptoms.
Your vet is basically going to put on their detective hat. They'll start with your dog's history. Do you live in a tick-heavy area? Then a thorough physical exam, feeling for any swollen joints. They'll probably run that quick blood test. And just as important, they're going to rule out other things that can cause similar signs, like a simple sprain or another type of arthritis.
And here's some more good news. For that small percentage of dogs who actually do get sick from Lyme, the treatment is usually very straightforward and really, really effective.
The go-to treatment is typically a 30-day course of an antibiotic. And honestly, the response is often pretty dramatic. Many dogs start feeling so much better, with less pain and more energy, within just a day or two of starting their medication. Now here's something important to understand about the treatment. The goal isn't necessarily to wipe every single one of those bacteria out of your dog's body. The real goal is to knock down the active infection, get rid of the symptoms, and let your dog's own amazing immune system take over and keep things in check, just like it does for the 95% of dogs who never get sick in the first place.
Of course, we all know the best treatment is always prevention. And this is where you, as the owner, have the most power. So let's build your prevention playbook.
Think of these as your 4 pillars of defense. First, use a good, vet-approved tick preventative all year long. Ticks can definitely be active on warmer winter days. Second, make daily tick checks part of your routine. Just feel all over your dog, especially in those warm, hidden spots, like under their collar, in their armpits, and between their toes. Third, make your yard a little less tick-friendly. And finally, know how to remove a tick the right way. With fine-tipped tweezers, pull straight out, nice and steady.
And what about the Lyme vaccine? That is an excellent question, and it's one you should definitely discuss with your veterinarian. The decision really depends on your specific situation, where you live, your dog's lifestyle, and their individual risk. It can be a fantastic tool for dogs in high-risk areas. So if you remember just one thing from all this, please let it be this. Don't live in fear of Lyme disease. Live with awareness. A minute of prevention, like that daily tick check or giving that monthly chewable, is worth so much more than a month of worry and treatment.
Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.